Hello and welcome to my new channel where you and I discuss health. My name is Dr. Manu, a medical doctor specialized in ophthalmology with a passion to see you well spiritually, mentally, psychologically, and of course physically. I trust that you are well. Today we will go one step further to see the signs and symptoms of type 2 diabetes. It is vital, my friend, extremely vital, that you and I must be educated, informed to see those signs and symptoms so that we can quickly seek help when they are there. But more importantly, this channel is designed for you and I to be preventive, to know, to be informed, so that we will go on living life by design and not from disease to disease, from crisis to crisis. Join me after the break when you and I will go through these signs and symptoms. Welcome back. Today, as promised, you and I will discuss the signs and symptoms of type 2 diabetes mellitus. Type 2 diabetes can develop slowly over a period of years, and the symptoms can therefore also develop gradually. At diagnosis, people who have type 2 diabetes may show little or no symptoms of the condition. Since symptoms of type 2 diabetes develop slowly, type 2 diabetes may be diagnosed following routine medical examination or screening tests for non-related conditions. Recognizing the early signs and symptoms of this condition can result in a person getting treatment sooner, therefore reducing the risk of severe complications. Greg et al. In examining the trends of diabetes in United States, the authors added that when diabetes is diagnosed at the age of 40, men lose an average of 5.8 of life, and women lose an average of 6.8 years of life, highlighting the importance of primary prevention of diabetes. It is very, very crucial for you and I to understand that we must fight whatever is in front of us as food to be able to prevent having diabetes, because you and I want to live. And look at the studies of Greg et al. Shows men, when having diabetes, they lose 5.8 years of their life, and women 6.8 years of their life. It's a lot. Do you know what you can achieve in 5 years, in 6 years on this earth? Why would you want to die before your time, my friend? My prayer, my passion is to see you well. My passion is that you will begin to look at what you are eating daily, that you will begin to examine with passion what you are eating, so that you and I can beat and prevent having this disease. Now, among the few common symptoms of type 2 diabetes, I will mention here some few, starting by frequent urination. When you need to get up many times at night to go and urinate, this is called polyurea. When blood sugar levels are high, the kidneys try to remove the excess sugar by filtering it out of the blood. This can lead to the person needing to urinate more frequently, particularly at night. Also, the person will start to develop blurred vision, and we found out in the last video how diabetes affects the small blood vessel at the back of our eyes, causing diabetic retinopathy, glaucoma, and also cataract. The presence of one or more of these conditions will lead to blurred vision. It can also develop skin disorder such as psoriasis or acanthosis nigricans. The person also can suddenly have weight loss or loss of muscle mass, itching, and yeast infections. The person with diabetes type 2 also can often feel hungry, particularly if you feel hungry shortly after eating. There can be increased thirst. That is what is called polydipsia, slow healing of cuts and wounds, tingling, numbness or pain in the hands and feet, feeling tired during the day, particularly after meals. Also, there can be presence of hypertension. This is found in 80 to 90%. Lipid disorders and overweight or obesity. Therefore, having these signs, you must quickly seek help by making an appointment to see your general practitioner. For this can be a sign and symptoms of you having diabetes type 2. I trust that you and I have learned something today about the signs and symptoms of type 2 diabetes, and can also be an agent of change in other people's life. If in your family or around you, you see people developing these symptoms, you can help them and advise them to seek help so that severe complications can be reduced. Knowing what you just heard, I trust that you have a preventive attitude towards your lifestyle, towards your diet, so that you and I can prevent diabetes, especially type 2 diabetes. Always remember that all what we discuss in this channel are only intended to be informative only. This is not a medical consultation, nor is it a personalized medical advice. For all medical advice, please consult your general practitioner. This is Dr. Manu reminding you that your health will improve when you start paying more attention to what is on your plate. Peace. I love you. See you in the next video.